I'd like to just introduce a little bit about what my topic is and what I've actually done here. So the topic that I am actually trying to put forward here to listeners and viewers here is dentistry as a career choice. Now, I know very well that we are in very different times today with the COVID-19 and the movement control order, so on and so forth. But times evolve, and so do professions. So as Mr. Chan just mentioned here, that from the time when dentistry was a profession where somebody would be scared to go and see a dentist, I think now I can tell you that the way students are trained today, it's a more welcoming place, a place of not going only when you have pain, but when for wellness as well. So I'm here to tell you why dentistry is one of the good career options that students and parents who are looking for careers for their children to consider about. So a little introduction. I am a dentist who is also specialized in the field, in a particular field of dentistry. I'll tell you a little bit more in my presentation about the different fields. The field that I specialize in is oral pathology and also medical education. And I've been here with Penang International Dental College for the last 13 years. And over the course of these 13 years, the school has successfully trained more than 600 dental graduates who are doing a fabulous job. And in my presentation, I will show you a couple of achievements as well as how their careers have modified over the course after doing this program. So we're all here at this webinar because you are at the crossroads of your career. You're either thinking whether I should take the right turn or whether I should take the left turn. And we as speakers here are here to tell you that if you take the right turn, you're going to do this, and this is what is going to happen. And if you take the left turn, this is what is going to happen. But let me tell you at the very outset that whatever career choice you take, you need to make that decision as an informed choice. You need to take into account what the career has to offer you, what is the standing, what is your return on the investment that you're going to put into this career. Okay. Keeping that in mind, I'm here to propose to you that why not think of dentistry? So dentistry, first of all, I'm going to answer this in this presentation as a question, as question and answers. So the first question that comes to my mind is, what is dentistry? I'm sure that's what is in your mind as well. For anyone who is a layperson, he or she would think that it involves extracting a tooth and maybe doing dentures. But there is more to it as we go forward. So it is an art and science of diagnosing and treating oral disease. It's not just caries or removing a teeth or filling a teeth. It's more than that. And the most important thing is that oral health is a key indicator of overall health, well-being, and quality of life. So in dentistry, you have a general dentist, a person who is trained with an undergraduate qualification with a basic degree in dentistry, who works in primary care along with Ministry of Health or has a private practice. And you have secondary care. That means dentists who work in hospital-based practice. So you do have general dentists who work in hospital-based practice, but you also have specialists. Okay, so a dental specialist is one who specializes in the field of one of the branches of dentistry. And dentistry today has around 9 branches that are recognized. So let me take you through some of the branches in dentistry. Number 1 is oral medicine and radiology. So this deals with the diagnosis of oral diseases and interpretation of X-rays and imaging studies. Now, these specialists, they interpret these X-rays and help other specialists and general dentists in planning up their treatment. Okay. Then you have oral pathologists who study diseases under microscopes. They help in detection of cancer and various other pathologies in the in the oral cavity as well as in the head and neck. The third are community dentists or public health dentists. They work in a variety of settings. For example, they promote health. They work in nursing homes, in community clinics. They organize community outreach programs, and they are among the strongest community in Malaysia who are supportive for the entire public healthcare system. Okay. Then we have the field of periodontics. That means the specialists who deal specifically with diseases of gums. We also have a field called conservative dentistry and endodontics, the field that deals primarily with restoration of carious teeth, aesthetic restorations, as well as root canal treatments. That means treatments wherein you can save the tooth by certain procedures that are done. So these dentists actually play a very important role as part of designing of smile, as well as part of maintaining the aesthetics of the patient. Then we have the prosthodontics, field of prosthodontics, which deals primarily with replacing missing teeth with dentures, fixed bridges, and implants. I'm sure many of you are familiar with the field of implants. It is a very upcoming field. It is a discipline that is interdiscipline, that is multidisciplinary. That means various different specialists as well as general dentists work together to give implant treatment to patients. And then we have oral surgery. Oral surgeons are basically, they perform surgical treatments on patients. For example, removal of tooth, facial reconstructions, so on and so fractures, so on and so forth. And then we have orthodontics, the specialists who deal with the alignment of teeth. That means giving braces. That means if you have crooked teeth, to which specialist do you go to? They are the orthodontists. And the field of periodontics. That means dentists who are specifically trained to treat children. That is between until the age group of 14. Okay, so we have a total of 9 different specialties. So just to give you a perspective of the importance of dentistry. So according to the WHO, the global burden of disease is estimated that to be around 3.5 billion people who are suffering with some kind of oral disease. So which is more than 50% of the global population. And in Malaysia, according to a study done in 2014, nearly 80.5% of the population need some form of dental treatment. So this is the volume of disease load and patient load that is there in our community. So that leads us to the question that why choose dentistry? Obviously, there is a field. This is the disease load that is there. And now, why choose dentistry? So first of all, it's a professional degree program. So I would like to mention here that dentistry, along with other healthcare professions, is considered to be a noble profession with very unique skill sets. So the scope of learning in dentistry is not just science, but also art and technology, which I think is the strength of dentistry. It's the only professional medical field, wherein you get the opportunity to not just learn science, but also art, because there's a lot of hand skill involved here, and technology. That is the application of high-tech technology for treating our patients. Second most important thing is that if you study dentistry, after you finish your training and serve the Ministry of Health, you have a big opportunity to open your own dental practice and be your own boss. That means you could be an entrepreneur. Okay, so we train students who can be self-employed. So you don't have to seek for employment per se, but you could also be self-employed and give employment to others. Third is there's growing opportunity. With the aging population and increase in access to dental care, the demand and need for dentistry is on the rise globally, not just in Malaysia. And best of all is you have a balanced lifestyle. I think if you speak to dentists who have graduated not just from our school, but from anywhere else, dentistry offers flexibility to balance professional and personal life. This is something that I found online in terms of showing to you what is the salary that dentists eventually earn as their experience actually increases. This is from a website called Salary Explorer, which mentions that the salary range of dentists in the experience of 5 years and above ranges from 12,400 to way up to 28,400. An average income is around 18,000. This is the salaries of dentists who are in private practice. So if you look at this in a broader sense, in the long run, dentistry is surely going to give you the return on investment, on your investment in education. So why choose dentistry at PIDC? Well, first of all, Penang International Dental College is a pioneer dental school, which is among the first private dental schools to have been established in the northern state of Penang. And right now, Penang International Dental College is rated 6-star by the Ministry of Higher Education as per the MyQuest evaluation. We are an MQA accredited dental school and recognized by Ministry of Higher Education as well as Malaysian Dental Council. And we have been awarded the Best Brand Award for the year 2016 for dental education. So we as a brand have established ourselves in training dental students over the course of so many years. So as I just mentioned to you, we are established from 2006, and we are a forward-thinking institution who have trained about 600 graduates, many of whom who are practicing in Ministry of Health, in private practice, and are pursuing higher studies. So I'd like to mention here that we have nearly about 25 dental graduates of ours who are pursuing higher studies in the UK, in Australia, in public universities in Malaysia, as well as in private universities here. So our alumni over the period of time have been working hard and have established themselves as well. So let me tell you some strengths and uniqueness of the dental degree program that we are offering. We offer a unique Doctor of Dental Surgery program. The first 2 years, it is a full 5-year training program, first of all. The first 2 years of clinical training is done at the Sarjana Putra campus at Maastricht University. And for the final 3 years of clinical training, the students come to PIDC, which is Penang International Dental College at Butterworth campus. Now, second of all, we offer a learning experience. We stress a lot on learning experience that will build character and shape future of leaders in the profession. So our students who go through our program experience learning from 2 leading private dental institutions. So you have the opportunity to do your preclinical training at Sarjana Putra campus at Maastricht University and the clinical training at Penang International Dental College. All of it full 5 years in Malaysia. And as part of learning experience, Penang International Dental College has strategic partners for student exchange. We have partners in Korea, Chonham National University. We have partners in Australia with the University of Queensland School of Dentistry, and with the University of Buffalo, USA, for student exchange program. The next strength and uniqueness of our program is the strong alumni network, which was established by our first batch of students who graduated in 2011. This group of alumni is very active, is a strong network, and are soaring really high. Many of them are still in work with the Ministry of Health. A large chunk of them have moved to private practice, established their own clinics, established their own practices, and a smaller chunk of them are actually pursuing higher studies and will soon be joining the workforce. I'd like to mention here that the Alumni Association, even in the times of COVID-19 MCO, is so active that they conduct live webinars inviting speakers from the Alumni Association as well as other reputed speakers to engage with the group of PIDC alumni to improve on knowledge as well as expand opportunity. So I'd like to congratulate them. The last but not the least which is the strength of PIDC, is our affordable tuition fee. So all this and more, we are offering at a tuition fee of 245,000. So at Penang International Dental College, the curriculum that we follow is an outcome-based curriculum. That means for every topic that the student goes through, he or she is made known well in advance as to what is the expected outcome, what is the minimum outcome, what is the overall outcome. And with respect to skills, there is a set of skills that are prescribed by the regulatory authorities, which are incorporated in our curriculum. And our faculty and team ensure and emphasize on skills training and exposure and help in building competency. So let me run you through some quick pictures on the resources that we have. There's a lot of information that's available on our website, on our Facebook page, on Instagram, as well as on Twitter. So you can go there and see as well. But a few pictures for our preclinical training resources at Sojanaputra campus. These are some lecture halls. We have the entire preclinical training facility over there. A digital library. These are resources from our Butterworth campus. So we're based in 6 floors in a high-rise there. And we have the entire dental clinic, our imaging labs, student recreation center, lecture halls, clinical training facility, digital oral pathology labs, cafeteria, student recreation, so on and so forth. Now, I'd like to mention here something specific about PIDC, which I also think is our unique strength. Now, PIDC, way back in the year 2010, was among the first dental schools to actually establish an e-learning portal. And this e-learning portal has been established by our strong team of IT, which is built on the principle of social networking. So we have an e-learning portal which supports blended learning. And we've been doing this for the last 8 to 10 years. And when we came up with this COVID situation, wherein face-to-face learning could not be taken anymore, we absolutely had no problem in migrating our entire teaching and learning online as fast as possible. So let me tell you proudly that right now, our entire teaching and learning is going on online. And we have made sure with the effort of the entire faculty that not a single day of the semester has been missed in terms of delivery of the theoretical content. Okay, so this blended learning portal that we have gives an opportunity for the learner to share experiences as well. It's not just a platform where the student just goes up and downloads lecture notes and interact and sends questions to the lecturer. But this is an interactive portal where the student can post their pictures, can write their reflective notes on that. We post a lot of educational videos on which there is interaction. There are discussion forums. We also have students posting up their personal experience. Here is an image of a student who went on a charity program to Cambodia and came back and wrote a reflective note along with pictures, which helped motivate many other students to take up such experiences. So I'd also like to mention that right now PIDC has, as I told you, has migrated entirely teaching and learning online. So with that, we now have our own YouTube channel where free lecture sessions are available, not just to our own students, but for anyone who is interested in updating their knowledge as well as getting in touch with content experts. So this is how these lectures are uploaded. Our lecturers actually put up their video on YouTube link onto the YouTube channel and then share the link with the learners on the e-learning portal. Okay. Yeah. Last but not least, the strength of our training program is our patients, and PIDC receives on an average 25,000 patients annually, and this is the major pool which gives exposure to our students to train, learn basic skills, improve their competency, and then go on to the job market where they go on to do well. So in short, we offer high quality recognized training program at an affordable fee. We're committed to an enriching learning experience, I'd like to mention here in this picture out here, I have 3 of my students who actually went up to win the International Association of Dental Students conference, a quiz conference over there, and were eventually sponsored to go and visit the White Clinic of Dr. Miguel, who is a celebrity dentist based in Portugal. So as I said, we provide opportunity for enriching learning experience. So your pathway to a fulfilling and rewarding career is what PIDC, Penang International Dental College, is here to offer. So please follow us on various medias, and for prospective students, please check our website, and also feel free to call us on the toll-free number. There are attractive scholarships that are available. We can provide you with more information on that. Thank you very much.
Hi, thank you, Doctor. Okay, thanks for the information. I'd like to welcome another colleague of Doctor. This is Mr. Vijay from PIDC as well. Hi, Mr. Vijay. How are you?
Hello.
Good morning.
Thank you.
Hi, hello. Okay, so interesting sharing, Doctor. Thank you so much for all this informative how to become a dentist, all those kind of things. So I think we have questions that from Facebook Live that actually probably is a private chat. That how long does it take to become a orthodontist? Probably one of you can answer and address these questions. Okay, all right.
Okay, I think I'll answer this. Well, thank you, Mr. Nick. Well, to become an orthodontist, basically you first need to finish your undergraduate training. And after you finish your 5 years of undergraduate training, there is a compulsory service with the Ministry of Health, which you need to do, which is a 1-year compulsory service. And after you finish that, you basically can pursue orthodontist training. So postgraduate training for orthodontia will take you 4 years. So basically, it will take you additional 4 years to finish and become an orthodontist.
Okay. Thank you so much. Yeah. Okay. If there is no questions, probably I can ask a few questions from my side here, if you don't mind, gentlemen.
Yes, yes.
All right. Okay. So I do understand that for this program, because of the facilities, all those things, you can't take too many students. Not like the business program that you can put 100 of students into a lecture. Can I know that how many students per intake that PIDC can take every semester or every intake?
Okay, every intake we are allowed to take 75 students only. You're absolutely right. It's not like the other programs where there is no capping, but here we have a limited number of students per intake, and that is 75.
So yeah, so it's competitive now. And the next question just came in. What are the requirements to enter the course? Probably you want to share on that, the requirement.
Yeah, maybe I'll ask Mr. Vijay to elaborate a little bit more on that.
Yeah. Sure.
Okay, the entry requirement, it depends whether the student is a Malaysian student or a foreign student. For Malaysian students, it's quite easy. They need to have their SPM, all right, and they must have 5 Bs in the science subject, biology, chemistry, physics, maths, and maths. On top of that, they must have a credit in their BM. Okay, this is the basic pre-requirement, and then they will need to have a pre-university study. Here, we can take any pre-university study. It can be STPM, it can be the government's matriculation, or it can be any foreign pre-university program like South Australian matriculation, A-levels, or anything. It's all there in our website. And if the student has done a pre-university study which is not in our website or not in the Dental Council's guideline, they can always email us where we will check. Okay, because there are some, they could have studied pre-university in some other country, which can be taken in on a case-to-case basis.
Okay, all right. Thank you so much. Yeah, for the I think it's actually available on the website also. That is, if you want to know detail, can check it out. But this is a basic requirement. Thanks for the sharing. Okay, so if there's no questions, that perhaps allows me to ask another questions that whereby I noticed that just now you shared with us about the online sessions that during the because of the pandemic, the MCO, you switch everything, and even it's a program that is lab based because dentistry is very lab based. And how? Just explain to us how you do it online for the past 6 weeks now.
Okay, for the past 6 weeks, what we've done is, I think the MCO got announced on the 16th, and then we just had one working day before everybody had to stay home. So what we've actually done is, as I mentioned, we've actually moved the entire theoretical component online. So you're absolutely right. It is an entire lab-based thing, and it is a skill-based thing. So without clinical and lab sessions, you cannot actually, the academic progress cannot take place. But in order to actually try and save the semester, we have right now started off with the online teaching and learning. That means the entire lecturing, the tutoring, as well as the supportive sessions are going on online, including assessments are going on online. So whenever we are able to return back to a face-to-face opportunity, we will be coming. We will have to move. We will have to continue with the lab-based as well as the clinical training, because this is a clinical training program. So that cannot obviously be moved online at this point.
Okay, thank you. So that's exactly the virtual educations that students should read out all this theoretical part at home now. So you are feeding them with all these informations. So when their MCO is lifted, they go back, will be more practical, more skill-based in the lab already.
Yes, that is what we're doing. And what the teaching and learning that we're right now doing is also a little bit different. I'd like to a little bit elaborate. It is not, we totally understand the situation. That means that students come from different backgrounds. Parents are also working from home. There could be issues with connectivity and so on. So we do not have synchronous teaching and learning. We have something called as asynchronous teaching and learning, wherein recorded sessions of teaching and learning are posted up. And then the student is free to access them whenever they have time, whenever they have accessibility. So you could read late in the night, early in the morning, or so on and so forth, and then answer questions, engage with your lecturers, and it is still doable.
Okay. Thank you for the answer, Doctor. Okay, there's one more question came in. Probably one of you would like to address these questions that I think we have explained earlier. Probably just answer her questions again. Yeah, on the foundation science and other.
The question is whether the student can do foundation in science in some other university and then join PIDC. Can. The student is allowed to do foundation in science in any university and join us. But in order to have a direct or preferential entry into PIDC, it's always suggested the student does foundation in science with our associate college, which is Masa University, where we also give scholarship for foundation in science. Students who have scored 9 A's in their SPM will study their foundation in science almost free. They only pay the registration fee. If the student has got 6 A's or 7 A's, then they get about 50% scholarship from the tuition fee. So it is more advantageous for the student to study with our own foundation, with our associate college, and then progress. But if they want to do anywhere else, the freedom is theirs. They can go and we will still give them an intake.
Okay, thank you so much. Okay, now there's one more questions from Dr. Chong also know about the fees, how much it costs, and the for the duration of the course. I think it's on the website that we have posted on the live, but perhaps just for the answering sake, that perhaps just to share how much is the cost and the COST.
As my dean has rightly pointed out, we are one of the most affordable dental degree program provider trainer in Malaysia. Okay, our tuition fee is 245,000. Okay, it is split evenly over 5 years. When you put all the other fees in, we are 299,700 ringgit, which is just a little short of 300,000 ringgit, which also makes us competitive. Okay, and we are still the most affordable, one of the most affordable in the country. And these payments are split evenly over 5 years, meaning the student pays less than 60,000 a year. Now, what else do we give? Okay, given the scenarios, we know everyone is having a bit of a financial crunch. So we are actually providing scholarship on a case-to-case basis. A scholarship up to the maximum of 30,000 ringgit is available per student. Obviously, there's a cap. We cannot be giving scholarship to all the students. And there are terms and conditions, which basically means, right, if a student has got a CGPA of 4.0 in their pre-university studies, they get a higher scholarship amount. All right. Also, if the parents are from a lower salaried group. All right. There are terms and conditions, but a scholarship of up to 30,000 ringgit for each student is available based on terms and conditions.
Okay, thank you so much. Yeah, there's one more question just came in. Mr. Vijay would like to address these questions from the audience.
Okay, the question is, if the student joins Masa's foundation prior to joining PIDC for DDS, can they get a package offer? To answer that, I'll have to be very specific. If the student joins Masa's foundation in science for the year 2020, then they would get the package. all right, where there is a discount for their foundation in science. But had they joined earlier, okay, they can still avail themselves to scholarships that are available. That depends on the terms and conditions that they have already signed when they signed up for their foundation in science. We would advise them to actually contact our marketing exec, and we will channel them to the right authorities to speak on this.
Okay, thank you very much, Mr. Vijay. Yeah, next question. I'm looking at that. Yeah.
Okay. Is the requirement applicable for my case? All right. I think what you'll have to do, Emily, is that you'll have to send us your basic qualification, and then we'll have to look in, compare it with the minimum entry requirement, and then we can let you know what would be the requirement. Right? Am I right, Mr. Vijay?
Exactly, Dr. Ajay. What happens is if you have a diploma in science where MQA is accepting it as equivalent to a diploma in their list, then you will immediately get an entry. But if you're a dental surgery assistant with a certificate, then you may not get into an immediate entry. We will have to check your pre-university qualification. If you have A levels or STPM or what, and if that meets the entry requirement, it's a bit difficult to answer a generic question like this. So you can always contact, send us an email, and we would respond accordingly.
Okay, thank you so much. Okay, I don't see any questions come in. Perhaps, gentlemen, I have a question. Not really a question, but I'm very amazed about, because this morning at 9 o'clock, I talked about the virtual education, all these kind of things that whereby it's so much of free available that Dr. Desang, you mentioned that whereby there's a lot of free lecture sessions that you put on the YouTube now, and you're actually encouraging some students to actually watch that how your classes is being conducted.
Yes.
Am I right? Okay. So this is an excellent, I would say that an initiative for those school leavers or the students that they might think of being a dentist, but they don't really know what the dentist study or in a class. So you actually have all these free classes now. The student can just go to YouTube and watch that how the lecture class of a PIDC is being conducted. Am I right? Is that?
Yes, absolutely. So you're absolutely right, Mr. CK.
Yeah.
That is actually one of the reasons why we have actually kept it open source, because not just our own students, but any other students who is interested in looking at or at how dentistry is taught, whether it is a prospective student, whether it's an ex-alumni who wants to refresh on certain aspects of dentistry, or it's any other student from any other university, we've kept it open source because this is a brilliant opportunity, I should say, for us to, not conserve what we know, but to share what we know with everyone. So I think that's the aim here. And
so will
sorry.
Will this continue?
Yes, it will continue.
Wow.
Yeah, I think we're in a phase of new normal, wherein I think face-to-face would have to be done in small groups in the future. I think 17th of March 2020 is not going to come back to us very soon. So that's the reality of the present situation. So we will have to, those face-to-face sessions will be in small groups. So we will be having to look at having these online sessions continue in this particular format, and interaction continue in this particular in this way.
Yeah, okay, but it's quite challenging, to be frank with you, that whereby a lab-based go online, virtual, and all this kind of thing is quite challenging for a college like you guys to run it. Yeah, sometimes.
Yes, certainly it is challenging, and I think we're not alone. We have all the dental schools equally facing the same challenge. But the aim is that at the end of this entire COVID nightmare, when we come out and we're able to run face to face, we would be able to focus our entire attention on clinical training. So that way, the time that is spent on lecturing, etc., has already been saved for our students, and then we'll be able to focus more on clinical training and making sure that academic progress continues, even though we're in these difficult times.
Yeah. Thank you so much for the sharing. So, student out there, whether you are SPM student or after A levels or whatsoever, you're thinking of become a medical doctor or being a dentist or whatsoever, now you can actually attend free classes at home.
Yes.
Isn't it? That you can you have to pay for what? How much? 300,000 almost to go to sign up. Am I right? But now you are having this for free to know yourself, whether that you actually this is the profession that you want, and then it's the classroom. Rather than, I often see that youngsters nowadays, gentlemen, that sometimes they go into the program after the 1 year. I believe that probably you have some students also. That's why sometimes this kind of program, you do interview with the student before you enroll them. Am I right? Do the student have to attend the interview before you admit them?
Yes, it's done on a case-to-case basis, basically, based on how on the minimum entry requirement and their application.
Okay, all right, that's good. So those who are applying to PIDC or thinking of going to apply, watch the YouTube back home. Okay, correct or not? Then understand, and then when you are called for the interview, at least you can explain to whether yourself or the other one, when during the interview, I've watched your YouTube or whatsoever, I think the chances of getting in is much higher by then. Am I right?
Certainly.
Okay, that's good. Now we have another about 5 minutes to end the morning sessions. That perhaps Mr. Vijay, you have anything to add, or even Dr. Ajay? Okay, anything to add on before we end our sessions here? Anything to add on? We don't have any questions from the floor now.
Okay, maybe Mr. Vijay could say a few things, then I'll wrap it up.
Yeah.
Okay, there are a fair bit of dental schools in Malaysia, both public and private. All right, so why PIDC? All right, so to answer this question, we would invite all the students or those potential students to actually come to our website and take a look, even our Facebook page, where they can see the interactions with our past alumni. Okay, they actually show how entertaining dentistry is for them. Right, earlier in Dr. Ajay's slide, he did show a picture of our student who won a dental Olympics, and they actually go overseas and they are there sharing the limelight with dentists who's popular all over the world. All right, and they have there are some, or I think a rather fair bit of our students have gone into social service, into NGOs. They are presidents of NGOs where they actually go to rural areas of Sabah, Sarawak, even Peninsular Malaysia, and give service. So you can see how diverse it is. You have somebody who goes to a celebrity dentist, and you have another person who actually goes to the rural area. Both of them are having different kind of service. Both of them are getting different kind of satisfaction, but both of them joined PIDC, and their career started from here. So students who come to us, you have got a diverse career opportunity. I think I'll pass it over to Dr. Ajay. Thank you so much.
Yeah, just to wrap it up, basically, I'd like to say that we offer a very unique program, right? So the strength of the program, as I told you, is that you have the opportunity to actually train at 2 reputed dental schools for a very affordable fee, right? That goes without saying. So our aim as the faculty, as a team, is learning experience, right? So it's not just academics. I've heard two speakers this morning, as well as Mr. Chan, CK, who told this morning that skills in this fourth industrial revolution is not just academic skills. It's not just psychomotor. A lot of it depends on attitude, right? And at PIDC, the faculty and the entire team gives our students that opportunity to improve on character, to improve on the attitude, and to be a responsible global citizen who can do well, not just in the profession of dentistry, but overall in their careers. So that's the platform that we're giving you at PIDC. So if you're interested, thinking about dentistry, feel free to call us. And then we have an entire team, dedicated and committed team, who will be engaging with you and clarify whatever you need. Thank you.
Okay. Thank you so much, Dr. Ajay. I think you got the right point that whereby in this industry, to be frank with you, it's not, the technology, all these things have to come in, but go back to the basic of this profession is still about human, isn't it? Yeah. So the attitude and the character is the key that is very important. That I like the way that you mentioned in PIDC, you emphasize so much about the attitude, because when your graduates go out, they are facing all this human.
Yes.
Isn't it? Yeah. The technology is just to help them. That's all. Correct.
Yes.
To make their works easier. At the end of the day, for the next 5 years, all this kind of attitude, the character building is so important for a dentist.
Absolutely. Absolutely.
Right?
That's why I told you, Mr. CK, that coming to a dentist is no longer going to be fearful. It's going to be a welcoming. Training dentists, we're going to welcome patients. Don't worry.
Yeah, I experienced that after 15 years, okay? I visited my dentist after 15 years, I find it, that's why. Okay.
Okay.
Thanks for
Yeah.
Okay, thank you very much, gentlemen. Okay, thanks
Thank
for the
you.
sharing
Bye.
sessions. Okay, by the way,
Okay.
before you move on, Dr. Ajay, you'll be back joining us for the panel discussions again for tomorrow, am I right?
Yes.
Okay. So we are going to have a panel discussions with Dr. Ajay, not today's sessions, tomorrow session. So if any questions, actually, you can actually come back and then to join our panel discussion with Dr. Ajay again tomorrow. Okay.
Right.
All right. So thank you very much, guys,
Thank you very
gentlemen.
much.
Thank you.
Yes.
See you. Okay.